Acupuncture is the traditional Chinese practice of inserting thin needles into specific points on the body. It's increasingly used in cancer centers as a complementary approach for pain and symptom management. But does it actually work for mesothelioma pain, or is it just a placebo? Today, I want to give you the evidence-based answer about how effective acupuncture is for cancer pain, what it can and can't do, what to expect from treatment, and how to find qualified practitioners. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding what acupuncture can offer helps you make informed decisions about this complementary therapy. So let's start with what the research actually shows about acupuncture for cancer pain. Multiple systematic reviews and meta-analyses, which are studies that combine results from many individual studies, have found that acupuncture provides modest but real pain relief for cancer patients. The effect is statistically significant, and that means it's better than a placebo, but it's modest, meaning it reduces pain by 10 to 30% on average rather than eliminating it. Acupuncture appears to be most helpful for musculoskeletal pain, neuropathic pain from chemotherapy, and general cancer-related pain. It's less effective for severe visceral pain from tumors compressing organs. For mesothelioma specifically, there haven't been any large studies testing acupuncture, but the research on cancer pain in general suggests acupuncture could help reduce chest wall pain, pain from surgery or procedures, neuropathy pain from chemotherapy, and general aches and discomfort. The key understanding is that acupuncture is complementary and not an alternative medicine. It's used alongside standard pain medications and treatments, not instead of them. Acupuncture might reduce your pain from a 7 out of 10 to a 5 out of 10, allowing you to function better or take less pain medication, but it won't replace your medications entirely. Now, before I go on, I'm going to take a break and ask you to do me a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, traditional Chinese medicine theory explains itself as working through qi and meridians. Those are concepts that don't align with Western medicine. According to traditional Chinese medicine, qi is a vital energy that flows through the body along pathways called meridians, and illness or pain occurs when this flow is blocked or imbalanced. Acupuncture points are actually specific locations along those meridians where needles can influence qi flow and restore balance. While these concepts aren't recognized in Western anatomy and physiology because there's no measurable qi or physical structure that corresponds to those meridians, the traditional framework has guided acupuncture practice for thousands of years. From a Western scientific perspective, acupuncture appears to work by stimulating nerves, which affects how the brain processes pain signals. It releases endorphins and other natural pain-relieving chemicals, reduces inflammation in treated areas, and affects the autonomic nervous system, which influences pain perception. The exact mechanisms aren't fully understood, but brain imaging studies show that acupuncture does cause measurable changes in brain activity and pain processing. And beyond pain, acupuncture has evidence for helping with nausea from chemotherapy. Multiple studies have shown that acupuncture and acupressure reduce chemotherapy-induced nausea and vomiting. Some evidence suggests that acupuncture might help with cancer-related fatigue. And acupuncture appears to have mild effects on anxiety and stress. The therapy also might improve your sleep quality. What does acupuncture treatment involve? Your first visit includes a consultation. The acupuncturist will ask you about your symptoms, your medical history, and your overall health. For treatment, you lie comfortably on a treatment table. The acupuncturist will insert extremely thin needles, much thinner than needles used for blood draws or injections. They'll be put into specific points on your body. The number of needles varies, but might be between 10 and 20. The needle insertion could cause brief, mild discomfort. It's like a tiny pinch or even a tingling feeling. But it shouldn't be painful, and once they're in place, you rest quietly for 20 to 40 minutes. Many people find this relaxing, and some even fall asleep. I have. The acupuncturist will then remove the needles. It doesn't hurt. Initially, sessions are typically done once or twice weekly, then less frequently as symptoms improve. Is acupuncture safe for cancer patients? Generally, yes, when performed by qualified practitioners who understand cancer care. Safety considerations include low platelet counts because if your platelets are very low from chemotherapy, there's an increased bleeding risk from needle insertion. So check with your oncologist before you get started. Low white blood cell counts also increase infection risk, so it's important that your practitioner uses strict sterilization techniques. And needles should never be inserted directly into the tumor site or through areas with active skin infections or radiation damage. Make sure you tell the acupuncturist about your cancer diagnosis, all the treatments you're receiving, all your current medications, any implanted devices like ports or pacemakers, and your current blood count if you know it. Qualified practitioners understand these considerations and will take appropriate precautions. Now, how do you find a qualified acupuncturist? Look for someone who's licensed in your state. Most states do require licensure to practice acupuncture. Certification by the National Certification Commission for Acupuncture and Oriental Medicine indicates that the practitioner has met national standards. Ideally, find someone with experience in treating cancer patients. Many cancer centers now offer acupuncture services through their integrative medicine or palliative care programs. These practitioners work directly with oncology teams all the time. They understand cancer-related issues. Once you've identified a practitioner, you should take some time and ask them some questions, including whether they're licensed, whether they're certified. Do they have experience treating cancer patients? You want to know whether they understand your specific cancer and the treatments you're receiving. And you should ask what their approach is to working with oncology teams. You should also ask upfront about costs. Some insurance plans do cover acupuncture, especially when it's being provided for pain management in cancer patients. Medicare covers acupuncture for chronic low back pain, but not specifically for cancer pain. To avoid an unexpected expense, check with your insurance carrier before you start treatment. But keep in mind that many cancer center integrative medicine programs offer acupuncture at a reduced cost, or sometimes they're covered by the center. What should you expect in terms of results? Don't expect immediate dramatic pain relief after one session. Acupuncture benefits typically build over several sessions. After 4 to 6, you should be able to tell whether it's helping. If you've had 6 to 8 sessions and you haven't felt any kind of benefit, then acupuncture probably isn't helping you and you can discontinue it. Realistic expectations for pain reduction of 20 to 40% rather than complete elimination makes sense. You should also have some improved function and quality of life. But you're not going to find that it eliminates your need for pain medications. It still might offer you other benefits like reduction of nausea. Are there areas where acupuncture won't help? Yeah. For severe cancer pain requiring high dose opioids, acupuncture is not going to be efficient. but it might provide additional relief alongside those medications. If you've got rapidly progressing disease with worsening pain, acupuncture can't keep up. You need aggressive medical pain management. For acute post-surgical pain, acupuncture might help a little bit, but again, strong pain medication is essential. You may have heard about acupressure. It's pressure that's put on acupuncture points without needles. This is gentler and it can be done at home. The evidence is weaker than for needle acupuncture, but it might help some people, particularly for nausea. C-bands or similar devices that apply pressure to the acupressure point on the inner wrist has some evidence for reducing nausea. To review, acupuncture has modest but real evidence for reducing cancer pain by 10 to 30% on average, helping chemotherapy-induced nausea and possibly reducing fatigue and anxiety. It's used as a complementary therapy alongside standard pain medication rather than instead of them. Treatment involves thin needles being inserted at specific points for 20 to 40 minutes, and it's generally safe when performed by qualified practitioners who understand cancer care. Look for licensed, certified practitioners with cancer patient experience, ideally at Cancer Center Integrative Medicine programs. When acupuncture is effective for cancer, it's generally evident through gradual improvement over 4 to 6 sessions. You can visit mesothelioma.net for more information about complementary therapies that have been shown to help mesothelioma. Or call us at 1-800-692-8608 or use the live chat feature on the website to speak directly to one of our patient advocates. As for me, remember to post your questions below, and I'll see you next time.